Thank you very much. Good afternoon, everybody. Good afternoon, everybody. Good afternoon. Come on. There we go. There we go. Thank you. Thank you, Susan, for that kind introduction. So I know I stand between you and happy hour. And I also would like a glass of wine. So hopefully this will be fun, informative to you. What I like to do this afternoon is give you a world tour of the science of teamwork. What is it that we know? What is it that works? What is it that you can do in your practice to improve your team, in your care, your practice? So before I get started, Susan already told you that I'm from Lima, Peru. So I hope you get used to my accent. It won't go away in the next hour. So and hopefully by the end you'll say, oh, you know, it's not bad. Can I have the first slide? All right. Thank you. So another thing is this is going to be a very practical presentation. I'm going to give you evidence-based guidance about what works, what doesn't work. You see my email there. I can send you a lot of papers on the topic that I'm about to tell you. Everything that you're going to hear today in the next 40 minutes or so has been published in medical journals, healthcare journals, etc. So I'll be glad to send you as many articles as you want. All right. So there is a science of teamwork. That's probably the first message that I think I want to convey to you. And this science has been going on for about 30 years, 35 years or so. And the reason that that's the marker is that in the 50s and 40s, the field of team dynamics emerged. But at that time, until maybe the late 1970s, most of the studies around teamwork were conducted in colleges with sophomore students performing tasks, contrived tasks at a university. It was in the late 70s when NASA, the military, began to say, you know, we need to study teams and context. We need to study experts doing real things in the real environment. And so in the late 70s, early 80s, this science emerged. And the primary, you can see in these pictures, that the primary funders and people who were in agencies, industries that were interested in trying to understand teamwork, of course, the number one was the military. And like Susan told you, I joined, I was a research psychologist, but the Navy hired me to develop a team performance laboratory in 1984. I was a one-man operation when I started, and by the time I left 15 years later, there were 45 psychologists, PhD psychologists, studying team performance, team decision-making, and the like. So the military, till today, continues to be focused on that. The second industry is the aviation industry. It should be no surprise to most of you that in the aviation industry, there's something called CRM, Crew Resource Management, which is a team training program that all the airlines use. The FAA mandates and regulates that they use this tool. And so all of the airlines till today continue to try to improve team decision-making in the flight deck and so forth. The third industry is healthcare. So when I became an academic in 1999, it happened that the Institute of Medicine issued the report on human error. And frankly, my career changed in 1999 because then healthcare became the biggest now supporter. Most of the hospitals wanted to improve their teamwork. And so about 75% of what I do these days is healthcare. I spend a lot of time in schools of medicine, a lot of time in hospitals. And so there's an obsession, rightly so, in healthcare with teamwork. The other, one final industry that is very much interested in this, like Susan said, is NASA. And this is one of the most interesting work I'm doing right now. So if we go to Mars, we're going to send a team. And this team is going to be 4 individuals. It's probably multicultural. There'll be probably a Russian, Japanese, 1 female as it's programmed today. And they're going to be in this journey that is 30 months, 10 months to get to Mars, as it's projected today, 8, 9 months to live there, and then 10 months to come back. So they have to, so team cohesion has become very much a need of trying to understand, NASA tries to understand the team cohesion because it's paramount to the success of the mission. And so we've been looking at astronauts now for 4 or 5 years. I can tell you none of them will volunteer to go to Mars. And I'll tell you very quickly because I like this, what we found. What we found was from the International Space Station, astronauts can Skype home with a 1-second delay so they can talk to their spouses almost in real time, to their loved ones and so forth. From Mars, the communication lag is going to be 40 minutes. I say hi to Susan, takes 20 minutes to get to her, and her reply takes another 20 minutes to get to me. So impossible to rely on mission control, to talk to your loved ones and so forth. But the most interesting from a psychological point of view is most of them say from the International Space Station, they can see Earth, this beautiful picture that you see on TV, right? So, and so they're connected. From Mars, Earth, it's just going to be a little dot, complete isolation. And so none of them are interested in going in. And frankly, when I go to these meetings, I think the people who, the astronauts that will go to Mars have not been born yet. So there's all this investment going on, and so we know a lot. There's a wealth of information out there on teamwork. A lot of that is summarized in the special issue that we did for American psychologists, but I'm going to give you a summary of that. I'm going to give you a few highlights of what is it that we know, now that you know who's interested in this. And so what I'd like you to, in the next 40 minutes is I hope you understand what drives team effectiveness. I hope it makes you think. I'm going to challenge you a little bit here. Give you a common language that you can talk about teamwork. I'm going to give you some advice, a few things that you can do as you get out of this door and as you get home Saturday or Sunday, things that you can do in your practice to improve teamwork. Along the way, a lot of evidence. Most of the stuff that I'm presenting today are meta-analysis after meta-analysis of things that we know, integrations of large number of studies on what works. So I know that when Jen asked how many of you in a team, I think all of you raised your hand, so that's good. But I just want to ask one question. How many of you are on a high-performing team? Meaning, how many of you think you are in the perfect team, the dream team? Don't be shy. Only a few. That's not bad. I hope at the end of this, you learn how to turn your teams into a dream team. All right. So why should you care about teamwork? Let me share some data now. Remember, I told you that we have lots of meta-analysis. So in 2008, the first meta-analysis came out that showed that if your teams exhibit good team processes, which I'm going to define for you in a minute, it leads to better performance by 20 to 25%. So this is the first evidence that we have that teamwork leads to better performance. The second meta-analysis is, I think, the most interesting one for all of you. I did this with my students. We published this in the Journal of Applied Psychology. We did a meta-analysis of medical team training. Now, I was, in a sense, compare hospitals or healthcare systems that had teamwork versus those who did not. And what we found was two things. And this article is getting a lot of attention. We found two things. One is that teamwork led to less errors, less medical errors, and teamwork led to a reduction in mortality in the hospitals. It saved lives. So here's the first connection that we have, that teamwork leads to better clinical outcomes. It's not a perfect meta-analysis because there are only about 6, 7 studies that really looked at teamwork with clinical outcomes. So the decay here, if you know anything about meta-analysis, is relatively small. But those are the studies that we have. But at least this is the first connection. Wall Street has begun to also, in the corporate world, began to look at teamwork. And I'm going to tell you why now the corporate world is doing this. And so they're finding that teamwork leads to higher revenue. And finally, some of you might have seen this already, but Google in 2016 did a study trying to find out what is it that makes our teams tick? What makes them effective? And I'm going to tell you what they found in a minute. So what I'd like to do very quickly is 6 observations. I'll give you a context about teamwork. I'll tell you about the science, give you some advice, and hopefully we'll have a few minutes for Q&A. If not, I'm sure going to be out there with a glass of wine, and you can ask me a question. Okay, so quick observations. This will be no surprise to all of you. Many organizations are using now teams. We're in the era of networks, of collectives, of everybody connected. And there's a number of studies shown there. Harvard Business Review did a study in 2016 and found that collaborative activities have ballooned in organizations by 50%. A lot of organizations are moving into team-based designs and so forth. And the reason the corporate world has, by the way, in my thinking, awakened to the need for teamwork is that economists have been analyzing innovation. And that what they're finding is, for example, there was a study published in 2010, 2011, 2012, a series of studies that found that these economists analyzed the patents that have been awarded in the US for the last 100 years. And what they found was that during the first 80 years, the majority, 90% of the awards went to individuals. In the last 20 years, 90% of the awards have gone to multidisciplinary teams. So our industry has made the connection, the corporate world, has made the connection that innovation, generational knowledge comes from multidisciplinary teams. So there's a whole wave now in the corporate world that was not 20 years ago, trying to understand teamwork. As some of you know, all teams don't perform well. In fact, there are 2 views to this. One is the business view. You know, it damages our results. But from a personal point of view, really, when you're not working with good teammates, when you don't have a good team, it drains you. It sucks all the energy out of you. And the reason is, I love this study in 2014, psychological study that found that the intensity of shared experiences, good or bad, are always amplified. And the example I give is, have a chocolate by yourself. It's not the same when you have chocolate with somebody else. And the same goes for beer, right? Or wine. It's always, when you have somebody else, all these experiences are amplified. And that's what happens in teams that don't work well. You know, all the energy that gets sucked out of them. Collaboration, teamwork, all the things, all this, it's not a linear event. And it doesn't come natural to all of us. And I'm going to show you a graph here in a second that I don't want to scare you, but this is when we study teams, this is the kind of things we need to worry about. Remember, teamwork could be implicit. When a pilot does this or this, he or she is communicating something. So teamwork is not only necessarily about overt communication. So it's complicated. So again, you don't have to read the small bullets. But when we study teams, we have to worry about what is it that you bring to the task, how the leadership is distributed, what the organization is influencing the team, and so forth and so on. So the little bullets that you see under each of these boxes are just exemplars. So that's why we have this 40, 50, 60-year history of trying to understand this problem. But we have some answers. Probably this is one of the first real nuggets that I want you to understand and to comprehend. What happens in leadership teams can permeate the organization. Yeah, I'm going to come to this point several times. So those of you who are CEOs, CFOs, team leaders, deans of schools, head of your practice, what you say, what you do, what signals you say, you send, that teamwork matters will make a big difference. Here's the second nugget. All good teams self-adjust. They self-correct. How did they do that? I'm going to say this several times. Debriefing. So if there's one thing that I want you to get out of here, and I hope there's more than one, is that the most powerful tool that all of you have, the most powerful tool that all of you have to improve teamwork in your practice is debriefing. It's self-reflection on what happened. What happened every day, what happened with this patient, what happened with whatever event. And I'll come back to that. And the final observation is, I love this one, because why are you listening to me? I'm an organizational human factor psychologist. And I found this quote. This is before the IOM report. But this was a psychologist who said, the human error in medicine and the adverse events that follow are problems in psychology and engineering, not medicine. There's no MRI, there's no pill to improve teamwork. So the reason I say this is because if the science is now, as we saw in the special issue, the science is rooted in organizational science, organizational behavior. But now there are a number of other disciplines studying teams. And so the message here is there is a science. You have to reach out beyond the medical journal, beyond the healthcare journals to learn more about this. Okay. So we need to understand what team effectiveness is. And so 30 years of this, 35 years. And now we have a wealth of information. So here goes. Here comes the fun part. The driving question behind the science of over 35 years is, how do we turn a team of experts into an expert team? And so in order to answer this very catchy question, you have to do three things. You have to understand what is it that you're turning this group into, the phenomena, teamwork. Two, you have to be able to assess teamwork. And if you can assess, if you can develop measures, tools to measure team performance and therefore understand team performance, then you can do something about it, like team training. So the science there have been three buckets that they continue. What is teamwork? How do we assess it? And what do we do about it? I'm going to tell you about the first one and the third one. If you ask me later, I can tell you a lot about measurement as well. Okay. Here's, I hope, the first thing to make you think. All groups, all teams are not created equal. In fact, in our science, we make a distinction between a group and a team. And some of you might say, well, that sounds trivial or academic. Maybe. But we put them on a continuum. Groups over here, teams over here. And in the continuum, the link between them is the level of task interdependence. So if you have to be a team in our science, I need the input from others. I need somebody else's expertise. I need the anesthesiology before I can perform the surgery. If you're a group, you're you don't need somebody else's expertise. You could be a brainstorming group that goes into a conference room to solve a problem, but there's no interdependency, okay? So groups over here, teams over here. And the reason that matters is because depending where you are in this continuum, different competencies matter. So the example I usually give is, if we have zero interdependence, I don't need you. What matters is civility. Let's get along or get out of the way. But if there's high task interdependence, we can hate each other, but we still need to take care of the patient. We still need to fly the airplane. And so it's important, the first thing you need to think about is, where is it that you fall in this continuum? My experience in healthcare, and the big challenge that you have as providers, as health providers, is that you fluctuate, and especially in primary care. Sometimes high interdependence, sometimes low interdependence. And so the first thing you need to think about is, what are the coordination demands that I have in my teams? Because that's going to dictate what competence I need. And so I usually have a number of sports there. I'm a soccer fan. I usually put a soccer ball, but a lot of people say, what is that? And so I had to put a football. So you get the idea. So this is one of the things you need to understand. OK. So now that you have that in your mind, here comes the science. So again, wealth of information, lots of information out there. So what I'm about to tell you is a heuristic that I hope helps you understand teamwork and helps us organize the body of knowledge out there so that you can understand it. So a few years back, we invoked the 7 C's of teamwork. It's not a model, it's not a theory. It's just a heuristic to allow you to organize this body. I'm going to go through all of them very quickly, and I'm going to take a little dive into each one. So the first one is capability. This is about team composition. Here's the first rule of teamwork. You cannot be a good team member if you don't know your own job. So this is about, KSA stands for knowledge, skills, and attitudes. So this is about, again, team composition. This is what NASA wants. NASA wants an algorithm that if we're going to send 4 individuals to Mars, what kind of individuals do we need to send? 2 of these, 3 of those, what kind? The bad news, to some degree, is that this C is the less mature. So a lot of the NASA work that is going on right now is on team composition. So stand by, because there's in 3 or 4 years, there'll be a lot of data on how personality matters and what kind of personality you need to have in your teams. So I'll say a little more about capability in a minute. Cooperation is about the mindset. I like being in teams. I want to be in a team. I seek the input from others, and I want the input from others. That's cooperation. Coordination is about behaviors. It's about role clarity and who's going to back me up. Communication is about information exchange protocols, and I want to make a little editorial here. Every healthcare organization that brings me in, do some consulting, they say, we have a communication problem. And I say, OK, let's take a look at that. And I've now realized, this is my experience now, 30 years of doing this, that invoking we have a communication problem is a useless construct because it's not diagnostic. And what usually my experience is that it's the other C's the problem. I don't like my boss. I don't know why I don't like my teammates. I don't know what to do. I don't have enough resources. So please, one thing that I don't want you to think is, when you go back, we have a communication problem. I'm going to say the 2 things that matter in communication in a minute. Teams do think. It's about the shared understanding. We call it team cognition. We want our leaders to be coaches. So we in our science, we talk about coaches. Why? What do good coaches do? They promote, they develop, they care. So that's what you want your team leaders to be. And finally is conditions. This is, I don't invoke culture, but this is about what are the organizational conditions that support teamwork. So let me walk you through each one of them as quickly as I can. The bottom line here is, all the studies, is that if you think that the best thing to do is to assemble a team of the best of experts, if you decide we're going to put the best engineers, the best nurses, the best technicians, whatever, the data is now becoming clear that the best, when you compose a team, they're all are experts, performance goes down. So having a team of all stars is not necessarily good. Why? Because you need people who have collective orientation, which is cooperative. All of you have a disposition. Either you're collective oriented or you're egocentric. If you're collective oriented, you want to be in teams, you like being in teams. If you're egocentric, you're the lone wolf. I'm sure none of you are here. But no matter what happens, you don't engage. Okay, so collective orientation, unfortunately, is not trainable. This is a selection. This is what NASA is working on, a test to determine whether you're collective oriented or not. And the reason this matters is, I want to use a sports analogy. I was reading Michael Jordan's biography not too long ago, and there's a quote from Michael Jordan that says, remember Michael Jordan, a big star, you know, the Chicago Bulls. And he says, it wasn't until we got Scottie Pippen that we began to win championships. And if you know anything about Scottie Pippen, he was never a high scorer. He retired. He's never a high scorer. He was a great defensive player, but he always had the most assists. So the star, Michael Jordan, needed somebody who was collective oriented in order to win. And that's what you want in your teams. You want some stars in your team, but also some people who are collective oriented, who are going to pass the ball. Collective efficacy. It's another, again, all the citations there, by the way, are meta-analysis. So this is, I'm telling you, this is all evidence-based. This is the most powerful predictor we have in our science. Collective efficacy is the belief that the team has that they can perform the task. Confidence. So if the team has confidence, what happens? They persevere, they continue. They keep going. So one way that easy way, a tip here, for you to build confidence, build collective efficacy, is to celebrate wins, to celebrate things that went well. Psychological safety. I'm going to spend 2 minutes here because I think this is the biggest problem in healthcare. Psychological safety is the license that you have to speak up. All teams, sooner or later, have conflict. The only way to resolve conflict is to have psychological safety. If not, we cannot engage in a conversation about what went wrong and what needs to be fixed. Okay? So psychological safety is one of those things that allows us to engage in difficult conversations. And that's the problem, I believe, you can correct me with a glass of wine, in healthcare. And let me share you a meta-analysis just came out. 2017 just came out, meta-analysis. They found that psychological safety leads to better performance, of course. They found that it leads to better OCBs. OCBs are organizational citizenship behaviors. People are nice when there's psychological safety. People share more information. They learn. This is very powerful. It really shows that this works. Now, some of you might be saying, what leads to psychological safety? The leader, of course. He or she sets the tone. We've done studies in the 80s with pilots that in 8 seconds we can manipulate whether the co-pilot was going to speak up based on what the pilot said getting into the cockpit. So leadership behaviors matter. Matters whether you have peer support, meaning we're going to engage in this difficult conversation. We're going to be emotional about it, but we still can go and have a beer at the end of the day. And the third behavior is role clarity, because then you know the boundaries of who's responsible for what. Google found that this was the determinant of effective teamwork. So this is going to sound funny, but if you Google psychological safety, it will take you to a website where all this stuff is in there. It's just amazing. All right, I'm going to skip this one in the interest of time. So another meta-analysis just came out. This is interesting to me. If you have interpersonal conflict, performance goes down. If you have process-related conflict, people come late to the meetings, they turn on the report late, those kind of things, performance goes down. If you have task-related conflict, it depends. Task-related is we disagree on the process, on the analysis to do. It depends, and of course, it depends if you have psychological safety. If you have psychological safety, task-related conflict is good, because then, again, you have this license to talk about the problems. The two things that matter in communication. The number one thing that matters is the sharing of unique information. What happens in teams is they get bogged down talking about the same thing over and over and over again, as opposed to somebody saying, time out. Does somebody have here details that we haven't discussed yet? So it's the sharing of unique information. In the second one, I want to tell you this story. So I was in Vegas doing research. And I'm a foodie, so I like. So I went to this high-end restaurant where the tables are all around the kitchen, so you can see what's going on. Very quickly, I'll tell you something. I was there 2.5 hours. Not a word was said in the kitchen. 2.5 hours, literally, not a word. So I finally introduced myself as I'm a professor, blah blah blah. And the sous chef came out, and he said, "So, hey, what's going on? You guys don't talk." I said, his words. We know the menu. We know who to pass the plate. We are we are an orchestra. So the point here is, more communication is not necessarily better. Better is better. So the best ORs I've seen are quiet. The best teams I've seen, I've studied over 30 years, are quiet. So what is the mechanism that allows them to be quiet? Is the team cognition part. So I'll give you another example. We were studying team decision making under stress. We had this command and control team of real sailors, and we were trying to see the effects of workload. So we were stressing, and we were giving a lot of workload, a lot of things to process in the computers. And we were finding some teams under high stress, tremendous workload, were maintaining performance without talking to each other. So finally, we concluded, of course, they have a shared mental model. They have a shared understanding of the task. They have a shared understanding of their teammates. They have a shared understanding of their mission. So under stress, they pass information to their teammates without somebody requesting it. I've seen that in OR. Scalpel ready before surgeon says, scalpel. The blind pass in basketball, what is? Two people who read how well is the defense position, how is how much time you have left, and they execute a task where I'm saying there goes the ball. So one of the hallmarks of teamwork is having a shared mental model, and it's trainable. Debriefing helps you with that, because you calibrate who needs to do what. And their culture, conditions. This is what actors in the signals. So very quickly, can I get 10 extra minutes? Please? The wine will still be there, don't worry, because I have a little more information to give you. So let me tell you the story. So this is the 7 C's. So not too long ago, an executive stood up and asked me this question. If I put a gun to your head, which of the C's is the most important? And I said, wow, my life depends on it. And he said, and you can only tell me one. Which one I said? Those of you who know the answer, don't say anything. Susan Bailey already knows the answer. Which one do you think I said? This is a very smart audience. That's exactly what I said. Conditions. And the reason is, another message for all of you I want you to take. You can have the best team in the world. They cooperate, they have a shared mental model, they have everything. They have the 6 C's. If the organization is not aligned to support teamwork, the behaviors will fade away. So the biggest problems I see in healthcare is most hospitals have rolled out, in practice, have rolled out team steps. How many of you know team steps? Just to disclose, I was the scientist behind it. And so hospitals have at a cost of millions of dollars. And then 2 years later, I get phone calls once in a while and said, these are very prestigious systems in the healthcare systems in the country. We're not getting the behavior that we want. And I say, let's look at your conditions. What is the CEO, CMO, CFO doing, saying? Are you measuring teamwork? Are you assessing teamwork? Are you reinforcing teamwork? So none of this is going to work unless this is the big challenge. I'm telling you, my experience, this is a big challenge in healthcare. We know that team training works. I show you a meta-analysis of that. We know they save lives, reduce errors. It's the sustainability of the behaviors that is the big challenge. in the sustainability behaviors comes from conditions. Favorable organizational conditions, then the people say, this is important, and we're going to do it. Now, I'm going to skip some of this, because I want to get you to this. So now, I'm going to give you, literally, give me 10 minutes, and about 12 things that matter. Again, evidence-based. This is kind of like a checklist. And I want you to, I mean, I don't mind sharing this, by the way, so I want you to really listen to these things that do work. The number one killer of teamwork in any team, any industry, teams that do any task, is the lack of clarity of roles and responsibilities. So this is the number one thing that teams need to have in order to succeed. Who's going to do what? And why? And with whom? A lack of clarity, number one, that you need to have. Number two is you need to have a compelling reason to exist as a team. As a team researcher, I want to tell you, teams are not the solution to everything. So don't deploy a team just because you think, well, this is complex, and it's going to require, a lot of people thinking about it. I go to some hospitals and I say, this is not a team problem, what you have here. You have an information flow problem. People don't know where to take the paperwork. I'm making that up, but it's, you have to have a compelling reason to exist. You have to have a coach, and there are a whole bunch of behaviors to do there. A coach that does very specific things. So, for example, here, how does a coach or a team leader generate psychological safety? We have study after study that have shown if the team leader self-corrects first, basically, he or she says, that didn't go well. I should do something else. And next time I'm going to do this, this, and that. Guess what that does? It gives license to everybody else to speak up. That's what effective teams do. Here's another one. Teams that engage in this discipline, pre-briefing, performing, and debriefing, outperform those that don't. The military does this real well. The aviation community does this real well. Especially the pre-brief before you go and do something. So this is a discipline that you need to create in your teams. I already told, effective teams have this sense of collective. They trust each other. There's mutual trust. And I want to make a distinction also. Trust is when you give others the benefit of the doubt. Psychological safety, which I think is the key, is when others give you the benefit of the doubt. So this is what you need to have. This sense of collective, of teamness. And by the way, this is all trainable, all can be fostered, all can happen. Share mental models, they trust. Expectations is a big one too. What is it that I'm supposed to do? What is the goal? What is my mission? And how I'm going to get there? If you manage that, you avoid a lot of problems. You have the right organizational conditions. And again, more is not better, but information exchange protocols are also key. It's about the terminology that you use, the accuracy of the information, the timeliness of the information. Effective teams do that very well. It's so unique. This is, a number of studies have come out with this. So if you're going to compose a team, it's the deployment of the team, the kickoff meeting, if you will, is key to the success of the team. That there is where you clarify roles, where all of these things come together, or could come together. You create psychological safety. It's the deployment. So when you launch teams, take the time to launch them systematically and to create all these other conditions. Okay. How about this one? This one just came out not too long ago. Lunch together. This is the studies. Guess where this comes from? Firefighters. So, what I don't want you to also get out of here after this 45 minutes. The only thing you learn is let's have lunch together with my teams. But this is one study that I found. This is some interesting things. Here's another one. I bet you, this is when you weaponize performance. Of course, nobody likes it. But since you're in healthcare, you're going to love this one. When I do that at schools of medicine, they all standing ovations. All right, I'm in the final stretch here. Some advice. So, of course, teamwork training is one. While I was the scientist behind team steps, I'm a proponent of well-designed team training. Okay, but I also want to make a distinction between team training and team building, because I'm sure some of you have participated in lots of team building. It's when you go to the wilderness somewhere and you perform tasks that have nothing to do with the job. When I used to live in Orlando, and there were 3 companies completely devoted to team building, one around dolphins, one around horses, and one around cooking. And I've done a couple of meta-analysis on this. Team building, 0 correlation with performance. When I published that meta-analysis, I got a lot of angry consultants phone calls, but I tell you, this is a big difference. So team building works for role clarity, because along the way in these 3 days, you learn about who you have next to you and who does what. That's what you learn. Team training is about skill building. It's about these competencies that we're talking about. Debriefing, I told you at the beginning, the most powerful, easy, underutilized technique that you can use. Meta-analysis just came out. Those who debrief outperform those by 25%. Oh, and by the way, there is a help. If you Google debriefing healthcare, hundreds of studies around this. In fact, there's a debriefnow.com website where you can get guidance, and it was designed for healthcare. Measure and reinforce. About measurement, we can spend a lot of time. Let me skip that. I'm a big fan of simulation. So you can do this, use simulation to improve teamwork. You don't have to have a big dome, a $50 million dome like we used to have in the military, or you have to mimic an OR or anything like that. There are games, serious games now, that help you improve teamwork. Oh, and by the way, I love to say this, because what works in gaming in simulation, by the way, it's not the bells and whistles. It's the instructional features that you have around it. The learning objectives, the measurement, the debriefing, the time for reflection. Okay? Leadership support. You know, again, it's been kind of quick, but hopefully you now know there is a science of teamwork. There's a lot of stuff out there. It's not perfect, but it's useful. There's a lot of that information, discoveries in the American Psychologist piece issue that we co-edited with Susan. And there's 2 or 3 articles in healthcare, one on ICU, one primary care, and then one in healthcare in general. So take a look at that. You know, I hope that at least you understand the 7 C's. One exercise that you can do, which I know some hospitals do, is decide which C's are the weakest and which ones you need to improve, and then work around those. I know some hospitals are using the C's, the C of the month, and they work on it. University of Washington in Seattle, and actually, if you go to YouTube and you put the 7 C's of teamwork, there's videos on all the stuff. So it's catching up. It's good to know. I should have trademarked that and be making money. All right. So finally, I want to tell you that I hope I educated you a little bit. I hope I give you something to think about, some tools that you can have. So with that, thank you and for your patience here, and I'm ready for some questions.